Hello everyone, welcome back to my YouTube channel Midcode Education. In this video, we are going to discuss about the anesthesia session. Okay, the series C00100201999. Okay, I have already uploaded in our previous video integumentary part 1 and part 2. Okay, so do guys check it out. Okay, so what is anesthesia? It is a state of controlled temporary loss of sensation or awareness that is included for medical purpose. So it's a state of controlled temporary loss of sensation. Okay, and under the effect of anesthesia, a person may experience analgesic paralysis, amnesia, and unconsciousness, which are usually reversible. Okay. It enables painless performance of medical procedure. Anesthesia is done before any medical procedure, complicated medical procedure. Clear? Okay. So, types of anesthesia. There are 5 types of anesthesia. Okay. General anesthesia, regional anesthesia, local anesthesia, monitored anesthesia care (MAC), and moderate anesthesia. Okay. Moderate conscious anesthesia. Clear? So, what is general anesthesia? General anesthesia means it completely suppresses the CNS. CNS means complete nervous system. Okay, so it completely suppresses the nervous system and result in unconsciousness and total lack of sensation. Okay, so a patient who have taken general anesthesia, the patient is in unconscious state and total lack of sensation the patient can affect. Clear? And what is regional anesthesia? Block sensation of pain from a large area of the body, such as an arm or leg or the abdomen. Okay, so it is block the sensation from a large area, for example arm, leg or abdomen. Clear? So this is called regional anesthesia. Again, regional anesthesia is classified into 2 types: central or neuraxial, also called spinal anesthesia. Clear? And subarachnoid anesthesia and epidural anesthesia. Next is peripheral nerve block. The best example for peripheral nerve block is root canal therapy. Clear? So it is regional anesthesia. And local anesthesia, it is block sensation of a pain from a specific area of the body. Okay, and no CPG codes are required for reporting local anesthesia, because local anesthesia is included in all the surgical procedure. So there will be no codes in separately for local anesthesia. And what is sedation? Next is sedation. Sedation means it is most similar to anesthesia but little bit different. Sedation means it suppresses the CNS to a lesser degree. Okay, without resulting in unconsciousness, patient respond to verbal commands and tangle stimulation. Okay, the patient who taken sedation or sedated, it suppresses the nervous system into a lesser degree. Okay, and the patient without resulting unconsciousness. Okay, patient can respond to verbal communicate with the doctors also, but in the case of anesthesia, the patient is completely unconsciousness. Okay, they have a lack of sensation will affected their body. Okay, so this is the difference between anesthesia and sedation. Okay, next is monitored anesthesia care or MAC. Okay, monitored anesthesia care short form is MAC. And this is a local anesthesia. Okay, procedure performed under local anesthesia along with sedation and analgesia for diagnostic and therapeutic purposes. It stays for a short period. Okay, it not a long lasting, it stays for a short period. Okay, and also fewer side effects and faster recovery. These are 3 level of sedation, including first one minimal level, second one moderate level, and third one deep level. Okay, there are 3 types of level of sedation included in MAC, and also they have specified modifiers also. Okay, indicated by some specific modifiers QS, G8 and G9. These are the 3 important modifiers including for a MAC procedure. Let us read what is QS. QS means it's a MAC services. It is used for a modifier MAC services. And next is G8. G8 for MAC for deep, complex, complicated surgical procedure. Okay. And G9. G9 is for MAC for patient who has history of severe cardiopulmonary condition. So in your documentation, the doctor documented what services or what was the condition, what was the level of sedation. You have to code appropriate along with the modifiers. Clear? So in your documentation, the physician documented MAC related services. You have to code QS. Okay, and it's for deep, complex or complicated surgical procedure related to MAC. You have to code G8. Otherwise, it's completely related to a history of severe cardiopulmonary condition. You have to go G9. Clear? So these are the three important modifiers. You guys just highlight this three modifiers. Okay, it's very important. And next is moderate or conscious sedation. What is moderate or conscious sedation? Both are similar. Okay, same. Moderate is also called conscious. It is completely a drug induced depression of consciousness. Okay, drug induced depression. Clear? Also, the patient can respond verbal commands and always required to monitor the level of conscience of the patient. Anesthesia code, it means 001002 01999 is the anesthesia code, right? It never be used to report the services of moderate or conscious sedation. Okay. A patient who an affect moderate or conscious sedation should be reported additionally with the procedure using the codes 99151 to 99157. It is the range of codes additional for coding moderate or conscious sedation. Okay, so you have to use these codes only, not the anesthesia codes. Clear? And also these codes represent the total time spent. So in your documentation, the physician reported the total time spent by the patient. Okay, so you can just check the total time spent by the patient, and after that you have to code the procedure. The code range related to moderate or conscious sedation is 99151 to 99157. Clear? Let us discuss more about 99151, 99157. Okay, first is services related to moderate or conscious sedation. First one, assessment of the patient. Second one, establishment of IV access. Third one, administration of agent. Fourth one, maintenance of sedation. Last one, monitoring of oxygen saturation, heart rate, and blood pressure and recovery. Okay, this is completely related to MAC. And let us discuss the code set under the moderate or conscious sedation. First set is 9951, 151, 152 and 153. These are the first set. Okay, here 153 is an add-on code. Okay, you can just open your CPT textbook and find the code. Try to read the description also. Here they have mentioned sedation administered the same physician performing the diagnostic therapeutic procedure. It is for same physician. Okay, and it's independent trained observer monitor the patient level of consciousness. Each code describe 15 minutes. Okay, the total time spent by the physician describe the 50 minutes. Okay, in this code 50 minutes they have mentioned. And additional time reported, you have to add-on codes like 99153 is an add-on code. Okay, and the second set is explaining 155, 156, 157. This is the range of the code. Here the sedation administered by the different physician is they have mentioned. Okay, different physician other than one performing the procedure, and the physician who administered the sedation monitored the patient level of consciousness. Also it described 15 minutes. And in your documentation extra time reported, you have to add on codes 99157. Clear? So do check it out guys in your textbook. There is a question. A 25-year-old patient is undergoing appendectomy. The surgeon performing the procedure administered moderate sedation. The procedure lasted 45 minutes. Report the codes. So this is the question. So you guys try to answer this question. Here the patient is undergoing appendectomy procedure was done by the physician. Okay, and also the physician performed a moderate sedation. The procedure was lasted by 45 minutes. Okay, do check it out, guys. Try to answer the question. Next is related to anesthesia services. There are three types of services including anesthesia. First one, pre-operative service. Second one, post-operative service. Third one, intraoperative service. So pre-operative service means a service before the administration. Okay, anesthesia drugs for anesthesia, and post-operative service means after anesthesia procedure. Intra means during the procedure. Clear? And also intra anesthesia services also, just read: administration of anesthesia, anesthesia care during the procedure, administration of fluid or blood, usual monitoring services, for example a person's ECG, temperature, blood pressure, etc. Okay, and also unusual services can be reported separately. The code for unusual means 36555, 36556 is for central venous catheter. Okay, and intra-arterial 36620, 36625 is for intra-arterial, and Swan Gangs 93503 okay is for included if done through the CVP separate vessels, code for both. Okay, just read, guys. And how to find the CPT code related to anesthesia chapter. First one, you have to check the anatomical location. Second one, the type of surgery done by the physician. Third one, the surgical approach. These are the main important three things related to find the CPT code. Okay. So here is the questions. First of all, anesthesia for cesarean delivery. Here the anatomical location is it's a cesarean delivery. It's abdomen. Okay, abdomen is the anatomical location. And also type of surgery done, it's a cesarean. Okay, and also the surgical approach is in the documentation. The surgeon describe if any surgical related procedure or any other surgical procedure related to the patients, you have to mention also. So these are the questions. I'm sharing 10 questions for you guys. You have to answer the questions. Okay, if you have any doubts or queries, you have directly mail to my mail ID midcodeeducation10@gmail.com. Clear? Second question is related to Whipple procedure. Third one, screening colonoscopy and anesthesia for appendectomy, anesthesia for otoscopy, anesthesia for coronary angioplasty, anesthesia for diagnostic arthroscopy of knee, anesthesia for complete amputation of penis, anesthesia for pectus excavatum, anesthesia for radical hysterectomy. This is a direct code and it's very easy to answer these questions. So try to answer these questions, guys. Okay, this video is enough for you. Next video I will upload more content related and more chapter wise questions. Thanks for watching.